by Dr. Doug Salvador, the Vice President for Medical Affairs and Healthcare Quality at Baystate Medical Center, and you also have a background in infectious diseases as well. Thank you for joining us.
Thank you.
So I'd like to talk first about Baystate's designation by the Department of Health as one of the 6 Tier 1 hospitals in the state to take care of people who would have Ebola. So how does that make you different than another hospital who's also preparing as well?
Well, Baystate Medical Center has agreed in collaboration with the Department of Public Health and the Mass Hospital Association to be one of 6 hospitals in the state, the only one in Western Massachusetts, to be a receiving hospital for a patient with suspected Ebola for testing and treatment, or with confirmed Ebola.
And how involved is the training process for the staff at the hospital? I'm assuming it's pretty great.
It is. We've taken a very systematic and careful approach to it. We have a simulation center that we use to train lots and lots of our residents and nurses and doctors, and we've basically taken the simulation center over to do this training. We're requiring 3 to 4 hours per nurse and physician in small groups, and we've been doing this training daily now for a couple of weeks to practice putting on and taking off the protective equipment that you would use in the case of taking care of a patient with Ebola, to make sure that we keep our staff safe and we don't have any instances of spread.
And what happens if somebody were to walk into the emergency room? Even that first person who's admitting them and taking down their information would need to understand those procedures as well?
We're screening all acute care visits that come anywhere into the system, whether it's a doctor's office, whether it's our urgent care centers, or whether it's walking into the emergency department. For patients who screen in by our questions, we immediately isolate them and do a more careful screening, which is done by one of our infectious disease physicians. If we deem that person to have a high enough risk that we need to test, then we immediately take them to a separate part of the hospital that will be sealed off from the rest of the hospital, and we're going to bring in the equipment necessary to do the testing, training, and there'll be a separate team of people who've gone through this 3 to 4 hour training, who actually assume the care at that point.
And what about the emergency workers and paramedics? Are you also working with the different towns and fire departments on how their response would be if they had to pick somebody up?
There's an enormous amount of coordination necessary. So the Tier 1 designated hospitals are meeting weekly with the Department of Public Health and the Massachusetts Hospital Association. There are many, many, many partners, including EMS and fire departments, but also suppliers from whom we buy the protective equipment, and other healthcare institutions in the region. And there's really a long list of items to check off and work through and plan for to be ready.
And do you feel, initially when the case happened in Texas, of course there was a lot of comments and criticisms like, hospitals weren't ready and nurses didn't feel ready. Do you feel at this point that hospitals around the country have really stepped up that preparation process?
I do. I think the awareness is very high. And certainly here in Massachusetts and at Baystate Medical Center, we've run through the scenarios. We've done training of enough staff that we know if tonight we had to activate our protocol, we'd be able to do it and do it safely.
And certainly it's an extremely low risk, but you have to be prepared in that unlikely event. But let's talk a little bit about the treatment of a patient who has Ebola. You have Nina Pham, who was that nurse that we all learned about from Texas, who's now been released from the hospital. Dr. Craig Spencer, who's in stable condition in New York. So what are the treatments that are keeping these patients, or have kept these patients alive and now released from the hospital?
So as you suggest, what we've seen is that the number of patients who've died of Ebola here in this country is very different and many fewer compared to where the epidemic is starting in West Africa. And I think there's a couple of reasons for that. Number one, first and foremost, is the supportive care we're able to give in an ICU setting in a first world hospital here in this country. So IV fluids, management, careful monitoring, that's an important part of the reason why people have been surviving more here. Another are the experimental drugs. So there's a couple of drugs that the people you mentioned have received. Currently, brincidofovir, an antiviral drug, is being released by the FDA for emergency use in patients with Ebola in this country, and that's been used, and we think that probably has something to do with the success rate in treating Ebola here.
And to ease the anxiety of people who might be watching, who might say, well, you know, I mean, the flu season is upon us, what could you tell people who are watching at home?
You know, in terms of the flu, there's general precautions that we take. If the flu is spread by droplet particles of water that we might cough or sneeze out of our mouths, and they generally don't travel more than 3 to 6 feet before they drop to the ground and then don't become a problem. General things like if you're sick and you have a cough and you're sneezing, cough into your sleeve. We recommend that. That'll help stop the spread. Frequent hand washing, not obsessive, but frequent hand washing during the day, use of hand gels helps prevent the transmission of these respiratory viruses. General good infection precautions is really what we should do, and everybody should get their flu shot.
All right. Well, thank you so much, Dr. Salvador, for explaining all the different procedures that you're taking at Baystate. Thanks for joining us.
All right. Thank you, Caroline.